I studied psychology in the first place was because I was always interested in gaining a deeper understanding of life and human nature. I'm also greatly fascinated by the unconscious mind and how it influences our day-to-day life. Working as a psychologist gives me the possibility to share my knowledge and experience to help people grow as individuals and to deal with difficulties and mental health issues they face. This, in turn, also aids my own growth as a person. Well, I first read for a bachelor's degree in psychology. I then completed a master's degree and a postmaster's diploma. Once I started practicing as a psychologist, I felt that I needed to better comprehend what it is really that renders our work as therapists therapeutic. This became a very pressing question to me. I thus read for a PhD on specifically what makes psychotherapeutic work therapeutic. Today I realize that I did not choose my PhD, rather it chose me. My work is not just a job. I see it as a calling, a vocation, and a life quest for me to find ever better answers to this perennial and persistent question. Well, I work with people who suffer from anxiety and stress, clinical depression, anger management, low self-esteem, multicultural issues, trauma, post-traumatic stress disorder, and complex PTSD, which is a bit different from post-traumatic stress disorder. I also help people in their experience of loss, bereavement, and the occasional stuckness in mourning, sexual and psychological abuse, and psychosexual problems. A relatively common presenting problem I get presented with in ever higher frequency is that of people facing meaninglessness, isolation, and lack of purpose in life. I help these people get in touch with their emotions to be able to discern what it is that gives them sense and therefore helping them live a more fulfilling life. I also do a lot of work with couples presenting with a wide array of relational issues, ranging from conflictual relations to infidelity. I also lecture psychology students and supervise other psychologists and psychotherapists where we discuss, think about, and shed light on their work with their respective patients. The first appointment is a meeting of two individuals, or three if it's a couple. The first session is actually probably one of the hardest of all. It's foundational because it allows therapist and patient to have a good look at each other and enables them to get a sense of who they are going to be for each other. Some patients find it to be a very anxiety-provoking experience. But if the therapist is able to empathize with them and they are able to endure it, then that is a good sign that they can work together and a sign that the work would have actually already started. I do both short and long-term work because I give every individual a tailored treatment according to their needs at that point in time. However, over time I have found that long-term work can be more satisfying in that it enables both the patient and myself to explore their life and their relationships in much greater depth. I like to use the example of the spider and the cobweb when thinking about this matter. If a patient's presenting problem is compared to a room full of cobwebs in need of a thorough cleanup, one can either choose to remove the cobwebs and achieve short-term benefit, knowing well that those webs will be back in place in no time. Or one can decide to tackle the spider, which involves dealing with their issues on a more long-term basis. For some people, it's enough to do short-term work, or sometimes this could be a first stint that prepares them for more in-depth work later on in their life. Others seek more in-depth work right from the start. I really enjoy the experience of the meeting with the person that takes place every week. It's very gratifying to see the movement of patients struggling to express how they are feeling towards developing a capacity to articulate their emotions and making themselves feel understood. It is very rewarding to endure staying with the patient's difficult feelings when no one else is willing to stay with and be fully present with them. I derive great joy when I accompany people in their suffering, seeing them being set free from deep traumas, nightmares, phobias, anxieties, and facing life rather than avoiding it. They become full participants in life rather than mere bystanders. I literally experienced the transformation of a person from being paralyzed or enslaved in addictions and destructive, compulsive, repetitive patterns towards feeling alive and free. It's also very fulfilling to see people find what gives them hope and meaning in life and working towards achieving the goals that they themselves set. Now I'll tell you a couple of dislikes. In fact, there aren't many things I dislike about my work, but two instances, however, quickly come to mind. The first one is when people come to me and present with highly complex issues for which they expect a quick fix. They expect me to sort everything out within a handful of sessions, when it's very evident to me that this is an unrealistic and unattainable expectation. The second is somewhat related to this, in that sometimes people start asking questions expecting very concrete answers. They ask questions like, what should I actually do? This hampers our capacity to continue thinking together towards attaining better insight and understanding of the presenting situation or circumstance. The terminology used to refer to the person who seeks help is one of ongoing debate. While several practitioners tend to use the term client, I much prefer using the word patient. I refrain from using client due to its business-like connotations of an object transaction which seem to divest the experience of its fundamental human qualities. The word patient comes from the Latin patiens, which means to suffer or bear, to endure. I thus use the word patient since I think it comes closer to capturing the struggle, conflict, despair, helplessness and suffering that the patients endure sometimes over a long period of time to finally decide to seek help from a psychotherapist and come to book their first appointment. Well, I can say that despite the difficulties of this work, my appetite for doing it has never waned. It just keeps sharpening because the experience of listening to a person and helping them feel understood and validated is one of the best feelings in the world.